What's up, gamers? Okay, this is the first thing in the entire book. Diagnostic criteria for schizophrenia, the ICD-11. So first off, schizophrenia is a psychotic disorder, meaning you lose contact with reality. You have difficulty telling the difference between real and imaginary stimuli, basically, and you also may not seek help due to the lack of insight into your own condition. We have the ICD-11, the diagnostic criteria here. Full screen this. So, you will get a schizophrenic diagnosis if a person shows one or more core symptoms for at least 1 month, or 1 or more months. Other causes of symptoms must be eliminated before diagnosis, and this is actually a weakness, as we'll talk about later. These symptoms are put into 6 categories, or 6 dimensions, they also call it. There's positive and negative symptoms included here. Sorry, my brain's kind of turned off. It's fine though. So, positive symptoms, hallucinations. First, what are positive and negative symptoms? Actually, we should go over that. So, positive symptoms are the presence of psychological abnormalities, while negative negative symptoms is the absence, or are the absence of psychological normalities, right? So, positive symptoms, hallucinations, the involuntary perceptual experiences occurring in the absence of real external stimuli. Like, you can have olfactory hallucinations, you can have, I can't think of any other words. Like, wow, I actually can't think of the word. But, hallucinations of sight, hallucinations of smell, of sound, lots of different things. Then we have experiences of influence, passivity, or control. Then that is feeling that your thoughts or actions are being controlled. Or like the feeling that ideas are being planted into your head, thoughts are being planted into your head, that sort of thing. Your thoughts are being controlled, that sort of stuff. Then we have delusions. These are fixed beliefs contrasting with reality. Usually they're also very hard for the person to not believe them. It's very hard for somebody to be convinced that these delusions are not real. We also have specifically delusions of grandeur, delusions of persecution, and delusions of reference. These two are important in the key study later in the chapter that I already made a video on, Freeman et al. Yeah. Let's just go over what these mean real quick. So, delusions of grandeur, the person may see themselves as exceptional in some way, so thinking that things are better than they are, really. Persecution, feeling that you're being spied on, or that people are, like, plotting against you, basically. Yeah, may believe that other people want to harm them, and may believe that they are being spied on, followed, or tricked. And ideas of reference is basically thinking that things are related to you, or about you, or made for you when they're not. Like, yeah, the person may believe that situations or events have personal significance, such as they are being given a sign about how to behave, or what is going to happen in the future. There you go. And we have our negative symptoms. One is flat affect, not experiencing emotional highs and lows like a normal person would. Next is avolition, not being able to carry out goal-directed behaviors. This could be as simple as not being able to put on clothes to then go to the store to buy food. That's an example. And then we also have other negative symptoms. Oh, I skipped over this, sorry. I skipped over other positive symptoms. Disorganized thinking, jumbled speech / word salad, creating your own neologisms. Neologisms are new words. And disorganized motor actions. Then negative symptoms, flat affect, not experiencing normal emotional highs or lows. Avolition, not being able to carry out goal-directed behaviors. And other negative symptoms, alogia, which is not being able to speak. Asociality, which is being asocial. And anhedonia, which is not being able to feel pleasure. That's where the hedonia part comes in, right? Like hedonism. Look at me, I'm an English student. Age of onset, it is earlier for males, early to mid-20s. Later for females, late 20s. Late onset is more common in females, however. And Lastly, there's rarely any diagnosis in children under 13 years old, as the symptoms regularly overlap with other more common mental illnesses like autism and OCD. So the symptoms would have to be very clearly schizophrenia for you to get a diagnosis in super early onset. Then evaluation of the ICD-11 application in everyday life. People only need to display these symptoms for a month, and then you'll be diagnosed. In comparison to other diagnostic criteria, which take longer, like 2 months, 3 months, this means that people can access treatment faster, and early treatment has shown correlations with better outcomes overall, and so this is obviously a strength. Another strength is the removed subtypes that were previously used to classify schizophrenia. These were unreliable as symptoms changed over time, and so they were replaced with the dimensional descriptors that we have here. And so this creates a more reliable diagnosis, which helps people access the right treatment for them. Weakness is that it's difficult to diagnose due to symptom overlap, as we talked about before. For example, hallucinations can be caused by sleep deprivation or drug withdrawal, etc. If the overlapping symptoms are not correctly eliminated, then diagnosis may be incorrect, and that decreases the reliability of diagnoses for schizophrenia using the ICD-11. Final weakness, cultural differences, is that there's a subjective nature for some of the symptoms, like hearing voices, for example, can be seen as a sign of being a visionary in some cultures, like I believe it was Maui. Let me see here. Yeah, Maori culture. It can be seen as being you're like a visionary or whatever, right? Versus in Western culture, it means you're fucking crazy and you need to go to a doctor, right? And this, of course, could lead to incorrect diagnosis if there is a conflict between differing cultures, either the patient or doctor, right? There you go. That's it for schizodiagnostic criteria from the ICD-11. Thanks for watching. Good luck on your exams coming up soon. Bye-bye.